Dr. Ferdinand Nsengimana. In this presentation, I'll be sharing with you the findings of a study titled Comparison of Malaria Control Interventions in Angola. The following is a quick review of the background of this study. Some successes in malaria reduction can be seen. Globally, there has been a decrease of 17% of malaria cases and 26% of malaria-specific deaths between 2000 and 2010. The number of malaria cases in Africa decreased by 30% between 2004 and 2010. Despite the decrease in malaria cases, almost half of the world's population is at risk of malaria. Sub-Saharan Africa seems to be the most affected region, with 89% of all malaria cases and 91% of all malaria deaths occurring from this region. The two highly recommended malaria prevention methods are insecticide-treated mosquito bed nets and indoor residual spraying. It seems to be unclear whether it would be more beneficial to use insecticide-treated bed nets and indoor residual spraying in combination or separately. To decide which method to use, one may consider factors such as the cost of each method, usability, resistance, and side effects. The median cost of protecting one person for 1 year against malaria is 3 times higher for indoor residual spraying than insecticide-treated bed net. Furthermore, treated bed nets are only effective when people in areas that are at risk for malaria sleeps under a bed net, while indoor residual spraying may require several spraying during malaria seasons and is only effective if at least 80% of the houses have been sprayed. Mosquitoes are likely to become resistant to chemicals used to treat mosquito bed nets, whereas individuals who applied the indoor residual spraying as well as inhabitants of sprayed houses were having higher plasma levels of the sprayed chemicals that are potentially harmful to human health. The above observation made us state the problem as follows. Despite the cost differences, usability, resistance, and possibility of used chemicals being potentially harmful to human health, insecticide-treated bed nets and indoor residual spraying have been used either separately or in combination without evidence of which of these two methods is more effective in preventing malaria. Knowing which of the two methods is more effective would ensure efficient interruption of the chain of infection and thus reducing the burden of malaria to individuals in particular and to the community in general. Therefore, the purpose of this study was to compare the effectiveness of insecticide-treated bed nets and indoor residual spraying. To the methods. This was a cross-sectional quantitative study that used secondary data of 2011 Angola Malaria Indicator Survey from Demographic and Health Surveys program. The target population for this study comprised of all households in Angola. 4 regional domains were identified. In each domain, 60 clusters were selected in 3 stages. In total, there were 96 urban clusters and 144 rural clusters. In total, 8,806 households were selected. In each selected household, all children aged 6 to 59 months were selected for malaria and anemia testing. Field work started in January 2011 and ended in May 2011. Secondary data from demographic and health surveys database were used. The data set was filtered using as inclusion criteria the availability of information on final results of malaria from blood smear tests. All cases with missing value on any of the variables were deleted listwise. This left a sample size of 909 participants for the first hypothesis and 2,272 participants for the second hypothesis. The study data were analyzed using the statistical program for the social sciences version 24. Chi-square was used with cross-tabulation to test the association between the independent variable use of BedNet in hypothesis 1 and the use of indoor residual spraying in hypothesis 2 and the dependent variable final results of malaria from blood smear tests. The logistic regression tested the predictive effect of the independent variables and the dependent variables. To facilitate the interpretation of logistic regression values, odds ratio were computed. The multi-logistic regression allowed testing the association between 3 or more variables. All statistical tests were conducted at 5% significance level, 95% confidence interval, and a p-value of 0.05. The following are the results of this study. Hypothesis 1 stated that there is no association between the use of insecticide-treated bed nets and contracting malaria. A chi-square test for association between children sleeping under a mosquito bed net and final results of malaria from blood smear test was performed using a sample size of 909. No cells had expected count less than 5. There was no statistically significant association between children sleeping under a mosquito bed net and final results of malaria. 9.2% of those who did not sleep under a mosquito bed net had malaria-positive blood results compared to 5.7% of those who did sleep under a bed net. The first model in the logistic regression was not statistically significant. The world statistic also support these results, showing that sleeping under a mosquito bed net the previous night does not predict having malaria. The second model was statistically significant. The world statistics also support these results, showing that the place of residence does predict having malaria. The third model was statistically significant. However, the world statistic of some categories in the World Index does not predict having malaria, while others do. Although the fourth model was statistically significant, adding household members variable to the model had no significant effect. However, the odds of a person living in a rural area having malaria are 9.49 times higher than a person living in urban area. These logistic regression results indicate that the type of place of residence and being in the richer or richest wealth index categories are the only significant confounders. When these confounding variables were analyzed together with the predictor variable, children under 5 slept under bed net last night, adding interaction terms such as using a mosquito bed net by type of residence, by type of place of residence, using a mosquito bed net by wealth index, or using a mosquito bed net by place of residence by wealth index had no significant effect to the model. The second hypothesis stated that there is no association between the use of indoor residual spraying and contracting malaria. A chi-square test for association between the use of indoor residual spraying and having malaria was performed using a sample size of 2,272, and no cell had expected count less than 5. There was a statistically significant association between the use of indoor residual spraying and having malaria. The measure of effect between the use of indoor residual spraying and having malaria shows the presence of statistically significant association too. Furthermore, 13.2% of those who lived in non-sprayed dwellings had malaria compared to 5.6% of those who lived in sprayed dwellings. The first model was statistically significant. The world statistics support these results, showing that living in a dwelling that was sprayed predicted having malaria. The second model was also statistically significant. However, only the world statistic for the place of residence variable remained statistically significant. The third model was statistically significant. However, the world statistic for different categories of worth index were not statistically significant. This indicates that worth index is not a statistically significant predictor for having malaria. Although the fourth model was statistically significant, adding number of household members variable to the model did not make significant contribution. Furthermore, the world statistic for the different categories in number of household members as well as other predictors were not statistically significant. This indicates that the number of household members is not statistically significant predictor of malaria. These logistic results indicate that type of place of residence, as was in hypothesis 1, is the only significant confound. When this confounding variable was analyzed together with the predictor variable, dwelling sprayed, the model was statistically significant. This model indicated that only the type of place of residence could predict having malaria. The odds of a person living in a rural area having malaria are 8.93 times higher than a person living in urban area. On to the discussion. The chi-square test for association and the logistic regression test revealed no statistically significant association between children sleeping under a mosquito bed net and the results of malaria from blood smear. Other researchers have reported that the risk of contracting malaria is not less for children who own a mosquito bed net than those who do not, while others found a double mean malaria prevalence rate among those who used insecticide-treated bed net alone compared to those who used both insecticide-treated bed net and indoor residual spraying. However, while other researchers found no significant difference in clinical malaria among children who used mosquito bed net alone and those who combined indoor residual spraying and mosquito bed net, some researchers' findings indicate that bed net users report lower incidences of malaria compared to non-users. One factor that could have led to current findings could be the way the original variables were constructed. The independent variable was children under 5 slept under bed net last night, while the dependent variable was final results of malaria from blood smear test. The incubation period for malaria is 7 days or longer. It could be that a child did not sleep under bed net last night but has been sleeping under one or the other previous nights, or slept under bed net only last night but not before. In the former, a child could be wrongly classified as non-user of bednet. In the latter, one could be wrongly classified as bednet user, while the infection happened before the person starts using a bednet. Another factor could be the biting behavior of mosquitoes. Bednet could be protective for people who sleep under one, but this protection is only limited to sleeping time. Bites can still happen in the outdoors and before bedtimes. About the use of indoor residual spraying, both the chi-square test for association and the logistic regression test revealed statistically significant association between children living in spread dwelling and having malaria. The low malaria prevalence rate in spread area could be associated to the fact that spread chemicals will remain effective for some period without household occupants being required to do anything further. However, indoor residual spraying does not prevent mosquito from entering the sprayed houses and eventually taking a bite, nor does it prevent the outdoor biting. This could explain the small, though significant difference of malaria prevalence among those living in spread dwelling to those living in non-spread dwelling. What could have been the limitation? Well, since secondary data were used, limitations associated with the use of secondary data may apply to this study. The data used in this study were collected in 2011. Although these were the latest available data, it could be that the current prevalence of malaria has varied during this time interval. The variable children under 5 slept under mosquito bed net last night does not consider the fact that malaria incubation period goes up to 14 days. Thus, possibility of misclassifying cases as bednet users or non-users. In conclusion, malaria is a common problem in Angola as well as in other parts of the world. Among several malaria prevention methods, the two highly recommended methods are the use of mosquito bed nets and indoor residual spraying. This study aimed at comparing these two highly recommended methods, and the results of this study indicate that indoor residual spraying is more effective than mosquito bed net when used separately. Thus, households in malaria-prone area should be sprayed in addition to any other preferred malaria prevention methods. Please allow me to highlight the ethical consideration for this study. Secondary data from demographic health surveys program were used for this study. Although the dataset were publicly available, the author had to register on the program's website and give assurance that data will not be used for purpose other than one stated, and that the data will not be shared with other researchers without prior authorization. The dataset did not contain any identifier of the subjects. Finally, a study proposal was submitted to and approved by the Institutional Review Board at Walden University. Ladies and gentlemen, may I use this opportunity to acknowledge that this is a part of a dissertation successfully defended at Walden University in partial fulfillment of the requirement for a degree of Doctors of Philosophy in Public Health Epidemiology in November 2018. This study was researcher self-funded, and the author has no affiliation with or involvement in any organization or entity with any interest in the subject matter or material discussed in this presentation. My contact details, the direct link to the full article are now displayed on your screen. And should you be thinking of a vacation and social distancing is an issue, think of Seekers Nest Limited. I thank you.